Thank you. My name is Robert Kaplan. I'm the Associate Program Director for the Masters in Advanced Studies. I've been with the program since its inception, and I'm a professor of practice in UCSD now School of Public Health. And so this program has just recently switched from the School of Medicine to the School of Public Health. And that means that all the faculty are now School of Public Health members. The two people you see on the screen were both prime ministers of England. And the woman who's sitting in the chair with her back to us had dinner one night with Gladstone. And boy, that was a great dinner. And after the dinner, she came out of it and she said, you know, I'm really amazed. I think Gladstone's the smartest person I ever met. And then it just happened that she shortly thereafter had an opportunity to have dinner with Prime Minister Disraeli. And she had a very nice dinner with him. And when she left that dinner, she said, I left the dinner with Disraeli and I thought I was the smartest person in the world. Which of the two is the better leader? Obviously, from what all of you said and from what we know, Disraeli. The key is to be a leader behind the scenes. Please, next slide. So some of you qualify. Talisa's already in the hospital, so she's either a doctor or a nurse. And we have had many people. Doug is an IT person. Erica, are you a nurse? You're a wait, therapist. But what physical therapist?
Recreation therapist.
No. Recreation therapist, right. And, it's just a good example. Doug works at UCSD, Erica works at Sharp. We've had people from all these other places, Kaiser, Scripps, the Navy. So it sounds like you are the intended audience, so that's great. And we have three objectives in the program. The first is trying to have you have ability to assume leadership responsibility in a healthcare organization. This program, even though it has the title, the Leadership of Healthcare Organizations, doesn't mean you're going to be the CEO, but you can be a leader in your unit or in your organization. And so we hope to give you the confidence and the information to be able to do that. And because we're all in healthcare, it's a very complex industry. Try explaining it to your family. And it's only getting more complex with the virus and the ACA, the Affordable Care Act. And so we want you to be able to articulate and address the complex issues. And then the key, and we have an advisory board made out of local healthcare CEOs, and they are looking for people in healthcare organizations who can produce productive changes through process improvement. And by doing process improvement at the same time, you're going to increase quality of care. So those are the three program objectives that are overarching. We'd like to have you get some competencies, and we have professional competencies, and the key really, and I think you all have it by applying for this program, is to have some passion for healthcare and making it better, and curiosity. Why does it work this way and how can we change it? So we focus on organizational leadership, how you can work within your organization. And then we do a lot of various work in the classes that help you identify your personal leadership style. So we have a list of courses here, oh no, get rid of it. interrupted, sorry. These are the courses, and the first 4 courses: strategic management, organizational change, process improvement, current topics in healthcare, and outcomes and quality improvement, and project management. That's our kind of concentration on giving you more expertise in process improvement that we just talked about. So there's 42 units, and unfortunately, we don't give you any electives, but these are very exciting classes, and they're taught by people that are actually doing the title of the class in the real world. So the difference between us and maybe an MPH program is that our faculty is mostly applied professionals. The culmination of your study is producing a capstone project, and it's a research project that tries to integrate all the different things you've learned in the courses, and you pick it. It's independent, and we ask you to do some creative scholarly research in one of the topics that interested you in the class, and also it may be something from your work or a place that you formerly worked. And I think the next slide, please. Here's some examples. So there was someone was interested in the globalization of healthcare, and we've had many international students in our program, so it's important to know about the effects of the flattening world and US healthcare. Then we had an interesting one. We had a physician from the Navy in Canada who was interested in having the patients be more involved in medical decision making. So she did a study within the military medicine to see how that's possible. And then we had this one, predictive analytics in the learning healthcare system and measuring provider satisfaction with group medical appointments. So those are just a few examples of the titles that are in the program, and Erica and Doug can tell you what theirs were if they remember. I know Erica does. Doug, it's 5 years ago. What can I say?
Been a long time, but yes, spent many hours on that. So yes, I remember the predictive analytics one was mine.
I know it. I know. I didn't remember the part about the learning healthcare system. So postgraduate job titles are clinical informatics executive, like Doug, assistant hospital administrator, project manager, like Erica, and we've had a lot of different job titles. So.
Great, thank you. Thank you, Bob. All right, so we want to introduce and give you guys a real experience of what the program is like from the perspective of the alumni. So Erica, would you like to go first and talk about how the program was for you?
Sure. Hello again, I'm Erica, and just so you kind of know, I currently work for Sharp Healthcare. I work in behavioral health at Sharp Mesa Vista Hospital. And I joined the program in 2018, and I chose the 2-year pathway. So that meant I did 2 classes a quarter, I think. And I just finished my capstone in September. And I joined the program because I manage a team of recreation therapists at Sharp Mesa Vista, and in that role have really enjoyed really finding the greatness in the others of the team and kind of helping to empower them to come up with innovative ideas, and kind of found naturally that, oh, hey, I'm a leader. So I started looking into various programs. What I liked about this program is that it was in person, and I know that it's adjusted right now for COVID, and I don't know the future of that, but I really value being with people, and I really liked that about this. There are a lot of other programs out there that don't meet anymore, and I really love that about this program. I liked the curricula offered and the variety. I do have an opportunity, or had an opportunity, to participate in a lot of interdisciplinary management kind of meetings, and had some of that exposure, but was really interested in learning more in areas I don't feel I'm very well in, such as the financial and kind of accounting and IT classes. So those were mostly the most difficult classes for me, but why I also really wanted to kind of round out my experience as far as being prepared to kind of further my career in a leadership role in healthcare. And let's see, some of my favorite courses, though, were the leadership courses themselves. You know, I am a therapist, so humans are of my interest, and I really liked, Dr. Kaplan, do you still lead those classes? I really enjoyed the leadership classes. I really enjoyed, I actually, believe it or not, though it was a lengthy paper, really enjoyed picking a leader to learn about and kind of apply some of the theories and really see. I really enjoyed also getting to like watch a movie and kind of really see leadership styles kind of vary among people. And that was really interesting to me because it helped me realize within myself what kind of leader I might be or strive to be. So I really enjoyed those classes, as well as my heart of hearts in healthcare is all about safety and quality improvement. So I really enjoyed the quality improvement class and process improvement. Luckily, I was also working on my green belt at the same time as taking process improvement. So I was able to kind of do both, improve, you know, as Dr. Kaplan said, for the capstone, for my process improvement class, I was able to actually utilize something real time that I was getting my green belt for at the time. So that was really nice experience. Sharp has a really great green belt program, and it's very healthcare. But what I liked about the professor, his name is leaving me right now, in the program though, was he really came from kind of more of the traditional like Toyota perspective. And I really learned a lot that added to my project I was working on. I really enhanced it a little bit more than what I was already learning in my green belt course.
His name is Dr. Philip Hansen.
Gosh, don't tell him I couldn't remember his name.
I won't.
My memory's so poor,
guy.
but you know, he was just, that's another thing that I loved about the program is just the professors, like all the teachers were great. Definitely some interesting people, but I learned something from all of them. So, and I think, did you want me to share about my capstone as well?
Please.
Yeah, that'd be great.
Okay. My capstone was post-hospitalization suicide prevention. And I really focused in on post-hospitalization suicide reduction in patients that have been hospitalized for behavioral health. You know, I did more of a research kind of study and review of various research out there, and looked at it as a systemic kind of how could, as a system, as a healthcare organization, what are all the angles versus just an assessment of a patient, and what are all the angles from a system level that can be put in place, and, you know, like creating a culture of safety where all suicides are considered preventable, and thinking of it in that way, and how do we educate everyone across the board in a system of healthcare so that this can be something that's achievable, and seeing it as something preventable and achievable. And did a lot of kind of diving into other, obviously it's something that's been researched for years and years, but sadly the rates continue to increase. So thinking about ways, most of the numbers are pretty sad when we see that a lot of people who have died by suicide were very recently had touched base within a healthcare setting. And then of course, obviously a very high risk population are those that seek services for mental health. So I really enjoyed researching that. And I guess my advice to all prospective students would be to just really manage time with that, and I guess really do something that you're passionate about. And that's what I enjoyed, is I picked a subject that really mean something a lot to me, and have been able to share some of the things I've discovered where I work and with the committee that focuses similarly on that topic.
Great.
So,
Thank you.
Great. Thank you, Erica. Appreciate it. Okay, Doug, would you like to go ahead?
Yeah, you bet. So as I noted, I graduated a couple of years ago now. So I think I started, kind of in the early 2010s. And, I think a lot of people will talk about the ISP, right? The Capstone Project that comes out of this. And I will, kind of, second the motion there from Erica that is like kind of a key thing, and trying to figure out what that passionate thing is that you want to do for your ISP is probably like something you, even if you're, contemplating joining the program now, starting to think about that. Because for me, that was, I enjoyed all the classes; they were amazing. But the ISP was really kind of the biggest piece of that really helped me kind of grow in the organization that I was in, right? So I joined the program because I wanted to learn, right? I wanted to do something new. Yeah, I wanted to have a master's degree, after my name and all that stuff, and feel important. But more than that, I really wanted to know something, something more, right? I wanted to learn something. It wasn't just I just want to have an MBA or something because everybody has an MBA. But I actually wanted to learn more about what was going on in the healthcare system, and I'll say the same that what Erica said, and I think what all the other students that I was with there in class. For me, like I really missed being in that environment. Frankly, like it's doing homework every night is like a little less fun. There's work to it, but being in class with people who are all there's like a certain energy to that of just students and people who want to like grow and do more. That's it's a little different from from my normal day-to-day work, and so I miss a lot of those things, right? And I'll that was why I joined it. If we're talking about like courses I enjoyed, I've got a couple topics to walk through here. I mean, like some of my favorites were really around the leadership pieces. I discovered during my kind of run up to joining the program that I really enjoyed leadership, right? And that there was moments when I could see that people were positively influenced by the way that I operated, and I kind of wanted to formalize how to do that better. And a lot of the leadership classes that we had there's one on like mountain climbing, which is like fairly famous, right? Like if you join the program, you'll know what I'm talking about. It's kind of like the quintessential in-class exercise that you do as a team. And I thought it was really fun, right? I think we succeeded, but not entirely as a team, and yeah, it was a real challenge, right? There's a lot of other classes I really enjoyed. There was the finance classes, project management, lean. I suppose lean was another big one, right? That's something that's also very heavily espoused in the organizations that I've worked in since. And so having that background was really helpful, right? Like I could, basically speak all the same language and speak, and converse very fluently with our, project management office and our lean offices when I was, back at Scripps working on these things. For my capstone, I think Dr. Kaplan alluded to that some, that I did like a fairly nerdy one. I'm an IS guy, I guess. And so, again, back in the early 2010s, there was something, the American Reinvestment and Recovery Act, I think, came out and basically created a bunch of incentives for hospitals and healthcare systems to start implementing EMRs, right? Hospitals had used a bunch of things for billing previously, but had really not spent the time to build clinical data sets. And so as I was joining the program, we're getting to that point where hospitals have, been hitting critical mass in terms of the data they have in those systems. And so the Institutes of Medicine, right, the learning healthcare system, which I think is what Dr. Kaplan alluded to earlier, was something that was put out by the IOM, I think in 2010. Institutes of Medicine pointed out that once we have all that clinical information stored in systems, we should be able to do better, right? We should be able to do research, on that data and be able to, use the data that we have in there to help our health, our system learn what should we do better, right? There's probably mistakes that we're making that don't look like mistakes, but when you look at the data, you see that they are. And so that was what I really wanted to do, right? That was my passion as I came in, and picking something that meant that I had to go and work inside of the organization that I was in to try and get to that data and find other people who cared about those things was really fun, right? For me, that it gave me power in the organization that I wouldn't have otherwise. And it would mean that I could go and talk to people. And I mean, if you're a student looking to like ask for information and trying to make the world a better place, you got like this like look on your face of like, I'm excited for this. People want to help you, right? I found that almost everywhere I went, almost universally, right? I would just show up. Like that was just my usual method, right? I would just show up and start talking to people, and almost everyone reacts well to that if you come in and speak nicely about it. And so, I went through IRB, which if your folks are, if you go through a Capstone project that has any data about patients in it, you have to go through that, right? Institutional Review Board. And so, that sounds like not very fun, but I actually enjoy doing that. I did it both at UCSD and at Scripps to get through my capstone, which meant talking to all sorts of folks in the entire organization to make it go.
And we got approval for his UCSD IRB after he submitted his paper.
No, that's not true.
Yes.
Very well. I will go with that one. So let's see what else I have here. Have I found this applicable in the workplace? Yeah, I mean, so, I think I covered that some, right? I spoke lean, like fluently, right? The, project management background, I definitely enjoyed that. And, has it advanced my career? Yeah, absolutely. Not long after, getting, graduating from the program, I got promoted to a manager over at Scripps, and they threw, several large projects at me that were significantly larger than anything I'd ever worked on. And yeah, I think, having that confidence in me from the program and having watched me go through it, I think definitely helped my leadership think like, yeah, we want to put that on Doug's shoulders. And so, yeah, so I think that's great. Right? I miss being in school, as I said, and, I highly encourage anyone who's interested in learning and growing. This is a great program. There's great people, both from the student side as well as the staff, right? I enjoyed a bunch of the folks, and actually I work with several of them, right? So Dr. Kaplan mentioned that most of the folks that do that are the professors in these courses are working in in organizations around here. So I mean, I work with Brendan Kramer, for instance, right? Like at UCSD now, and he was our prof for finance, right, back in the day, I think, and he's moved up in the organization as well from his time there. Yeah, so I'll stop talking there for a second. I covered most of the things I thought I should chat about. So if there's questions, I'll be quiet and answer those.
Great, thank you, Doug.
Yep.
Okay, next we're going to go to some of the nuts and bolts of the program. Kat, would you like to go ahead?
Yes, yep. Thanks, Doug and Erica. That was wonderful to hear your perspectives and experiences. So for this program, you might have seen a little bit earlier, a few slides back, the courses that were listed, but the total units required are 42 units, and all those 42 are required to complete and get the degree. 14 of those units are process improvement courses, so you do spend a lot of time focusing on process improvement, which I think is wonderful. 22 units is the additional required courses that Dr. Kaplan went through, and then 2 units of a professional development seminar and mentorship assessment course. This is your preparation for the final capstone course. So the final capstone course is 4 units. Like Erica and Doug described, it's that final class, the final large project that you'll work on and then present and be reviewed for. All right, and the nice thing about LHCO is there is a lot of flexibility with the pace of study that you choose. So for instance, we'll start on the left here, 4-quarter pace. So that would be a year-long program. If you wanted to complete this program in 1 year, can be rather intensive in the sense that you would be taking 4 days a week, 4 classes per week, per quarter. So that's, say you started in the fall, that would be fall, winter, spring, and summer. And we do have several admissions cycles. And so that 4-quarter pace of study, typically we have international students do this pace of study, but it's open to domestic students as well. And then I'd say the most popular option and choice that people go with is the 2-year pace of study. So this is the one in the middle here, 6 to 8 units per quarter, and it's 2 to 3 days per week, depending on the quarter and how many courses are offered. So this one is definitely seen as nice and flexible for people who are working full-time or even part-time, if you'd like to have the program a little more spaced out. And again, like I said, it's the most popular option. And then the 3-year pace of study is definitely more spread out. It's in, you finish it in 3 years. It's 1 to 2 days per week. So stretched out a lot more, and it is slightly more expensive. As you can see, the price increases, and that's really because of per quarter registration fees, the university UCSD fees. All right, so admissions requirements. So for all three of our master's programs, we do require, I'll start at the top here, the bachelor's degree. So in the application itself, you would just submit your transcript, and we would start with an unofficial transcript, and then a GPA of 3.0 minimum. We ask that you apply with a 3.0 at least. Occasionally, we have accepted a few students with a lower 3.0 GPA. And then work experience. So for LHCO, we really encourage students or applicants to have had, at least 2 years of work experience out there in a healthcare related field. Of course, there's a lot of variety with this, but we do encourage people to not be fresh out of a bachelor's degree to get a few years of work experience before applying. And then the statement of purpose here. So this is, I highlighted as a very integral part of the application and really how you would stand out as a student or as an applicant. So in this statement of purpose, it's an essay and it's about 500 words, but you can certainly go over that and make it a few pages if you'd like, but it's really your opportunity to highlight why specifically LHCO is of interest to you versus another, master's program in public health or something like that. And the admissions committee is really looking to see what your goals are as well in this program and after the program as well. And then we do require a resume or a CV to be submitted. And then if you're an international student, we would require a TOEFL or IELTS score to be submitted. And then 3 letters of recommendation to close out. So these letters of recommendation, we would like at least one to come from either current supervisor or a past supervisor, maybe somebody you've worked with as well, who has, experienced projects with you and things like that, as well as potentially a faculty member from your bachelor's degree. And then like you can see up there in the left-hand corner, no GRE is required or GMAT, which is pretty nice for a lot of people. Be nice for me for sure. Okay, so questions. Yeah, so we'll go ahead and take some questions in a bit, but I want to mention here below it says the email. So go ahead and email me questions here at lhco@ucsd.edu, and I'm happy to discuss very specific questions with you. I can even jump on a Zoom call if you'd like to get more in depth. And then the website here, we actually just redesigned our website, all 3 of our programs. So pretty exciting, and you can catch the website and a lot of good details, also some more alumni stories at lhco.ucsd.edu.